Hi, my name is Brogan Evans and I'm a junior at the University of Southern California. I was recently a patient here at UC Irvine Medical Center, where my father is a surgeon. I went on vacation with my family to Hawaii for my parents' 25th wedding anniversary, and I noticed I was having a hard time walking up hills and I was getting really short of breath easily, which was unusual for me considering I'm a very healthy guy. I like to work out at least once a day, and I didn't really want to say anything because it was such a special occasion for my parents. So I kept it quiet even though I was experiencing these problems, and I went back to school where I later had more problems with this. A few days after I got back from Hawaii, I went back to school, and I was waking up early for a class, and I really wasn't feeling that great. I must not have been feeling too great because I ended up collapsing, and I woke up to my roommate standing over me asking if I was okay. I tried to get ready for class, but then I ended up collapsing again, and after that my roommate called 911 and the paramedics then came and took me to the local hospital where they diagnosed me with internal bleeding. They pumped me full of fluids because I was dehydrated, and then they wanted to discharge me, but my dad came up and wanted to take me to UCI for further examination.
As a parent, I was concerned about Brogan and making sure he had the best care possible.
In the car on the way to UCI, I was scared. I had no idea what was going on with me, and I didn't know how it was going to be fixed.
I knew that I could get the best possible care here at UCI. I had an opportunity to see Brogan when he was in the emergency room up in Los Angeles, and speaking with the physician there, found out a little bit about what the potential problem could be.
I was admitted at UCI where they took me to a room and put an endoscope down my throat to diagnose where the bleeding was coming from. They diagnosed that I had bleeding ulcers, and then they cauterized it all in the same procedure. And then they kept me overnight and for a couple of days after to monitor my blood count and see how I was doing. Now that they had fixed the problem, they wanted to find out what had caused it. A few weeks earlier, I had injured my shoulder, and I was on the maximum recommended pain medication dosage. It turns out that this, along with the combined stress of school, were eventually what caused my internal bleeding. I'm familiar with UCI because of my father, but I've never been an admitted patient before. The doctors and nursing staff were fantastic. They have a great amount of professionalism, but they also try and build a relationship with their patients. I felt like I was in a familiar place. I felt secure, and I really felt like I was getting the best care that I could for the problem I had. Thanks to the care that I received at UCI from the doctors and nurses, I'm confident that I can go about my everyday life without having to worry about these bleeding ulcers coming back.